Now we're going to talk a little bit about the appointment system. As you probably are aware, we triage all same-day appointment requests. The reason for this is our demand is high. As you may be aware, we have about 13,000 patients, and on an average Monday, we may get about 120 people asking for a same-day appointment. This is impossible for us to give, so we have to doctor triage all same-day requests to ensure that the patients that really need seen that day are seen. Obviously, we have to put quite a lot of resources into triage, and this reduces the amount of routine appointments. We understand this can be frustrating. However, what we want to do at the end of the day is make sure that the patients that really need to be seen are seen, and that is why we triage. We understand that it can be frustrating waiting for a call back, but at the end of the day, your safety is our most important thing. So, if you are asked to come down an emergency appointment, generally you'll be asked to come down to the GP pool. The GP pool has been set up to ensure that all same-day appointments can be dealt with in accordance with clinical need. That may mean that someone who is more sick than you will be seen before you, even if you've been waiting longer. There is no appointment time for the pool, so you may have a wait depending on how busy and how many emergencies we have to deal with. We understand that this can be frustrating, but please remember, we are just trying to see the sickest patients in the quickest possible time. We do prefer for routine appointments that you see the same doctor. This is important for continuity of care for both the patient and the doctor. Sometimes you may be asked to see a nurse practitioner. They are able to deal with many minor illnesses and self-limiting conditions, as well as a whole array of other stuff, which the nurses will speak to you about later themselves. If you think you require a house call, please call where possible before 11 o'clock so that the doctor can triage your request and discuss the best form of action. House calls are limited to patients who are housebound or who are too ill to attend the surgery. This will be at the doctor's discretion. The reason for this is because it is obviously much faster to see patients in the surgery, and we have much more equipment to deal with all the various medical problems in the surgery setting. If you do take unwell in the afternoon, please call the surgery as normal, and the triage doctor will assess your case and make the necessary arrangements for you to either be seen at home or in the surgery, depending on clinical need.